now, we're going to bring you live to that press conference as it gets underway at the La Crosse County Health Department.
Shortly. I will give a couple of brief updates, and then they can have a chance to speak about their topics, and then we'll take questions and answers. So first of all, I'd like to talk about where we are in terms of case numbers, remembering that case numbers are just one way for us to be tracking this situation. At the state level, we received news around 1:30 that our case total in Wisconsin is 585. That is an increase of 128 cases from yesterday. The number of negative test results are at 10,089. And that is about 5% of individuals who are being tested are testing positive. We also have 6 deaths in the state of Wisconsin. That is one more than yesterday. Yesterday, locally, I shared with you that we had moved up to 10 cases. We are now at 12 confirmed cases, and those cases are in both in females in their low 20s to low 30s, and they thankfully have mild to moderate symptoms and are isolating at home. The investigation of those cases is ongoing, and we continue to speak with all of our cases and their contacts and continue to work to make sure that everyone who may have been exposed is aware of that and is properly following guidance. Next, I will just reiterate that we shared yesterday that 2 of our cases were determined to be of community spread. What that means is that we cannot determine a source of exposure that would be travel related or would be relating to close contact with someone who has confirmed COVID-19. So we expected those to come, and again, we expect those numbers to continue to increase. We will not be surprised by that at this time. You all know that this morning at 8 a.m., the Safer at Home order from the governor went into effect. We have received a frequently asked questions document and have posted that on our La Crosse County /COVID-19 website. We also have had a number of questions in our call center about businesses and whether or not they are exempt. So again, reference that order and the FAQ, the frequently asked questions document. If you do not get your answer after looking at those resources, we encourage you to contact the Wisconsin Economic Development Corporation. And if it is not available through them, they have a mechanism to ask a question about whether or not a business is considered essential or not. In addition, I do just want to talk briefly about masks. Masks has been a hot topic in our community and in many other communities across the state. At this time, I want to make it clear that we have received a lot of communications about individuals who could produce masks, who could make masks. We are grateful for people wanting to help. By the end of today, we will have a posting on our website. We will also email individuals who have emailed us that they might be willing to produce masks. We will send the evidence-based as best we can, the research that we've done about the best types of masks that can be made, and we will get that out to everyone by the end of the day. Our role here at the health department will continue to be providing factual evidence and information to the best of our ability. We will not be accepting masks. However, we are looking for a community agency that would be willing to take on that coordination role. So we don't currently know who all in our community needs masks. We have asked long-term care facilities. They feel that right now for the next couple of weeks that they're okay. We think that there is the same message is coming from emergency medical services. So we do want to acknowledge that at some point masks might be needed, but remember that those are a last resort. The first line would be use of proper personal protective equipment, and as long as we have access to those, that's what everyone, including healthcare, will be utilizing. So just know we'll get some guidance about the pattern by the end of the day. Our role will be information sharing, and we'll look for a community agency that might be willing to coordinate the need for those masks and the production of those masks by members of our community. I also want to be very clear that we are not asking community residents to go out to fabric stores and purchase fabric or materials that might be needed to produce masks. That is not considered essential travel, and that would be potentially dangerous to the situation we're trying to control here. So if you have supplies already at home and can do that, wonderful, but we wouldn't ask you to go out and find supplies if you don't have them. And lastly, I think I will just indicate that we continue to be really proud of this community, doing what it can, doing all that we can to help assure that the numbers of cases we have here, the numbers of individuals that have illness and have severe healthcare needs is low. We hope that that does not continue to increase like we've seen in other countries. And I think what we're doing here is going to make a difference. So please follow the governor's order, stay at home, keep your necessary travel to an absolute minimum, and I think we will continue to work through this together. So at this time, I'll turn it over to Dr. Kowalski from Gunderson.
Thank you, Jen. I would just like to echo a few things that Jen said today. I'm Dr. Todd Kowalski, an infectious disease physician at Gunderson. I think I would start with how proud I am of this community, how proud I am of the response that people have had. And I would also just want to emphasize the importance of the social distancing, the making a difference in terms of separating yourself from other people in every avenue that you're at. In terms of testing, I would just like to make a couple of comments about testing because I think we're hearing a lot of comments and questions about testing. My first comment would be testing is appropriate for those folks who can make the biggest difference in their health and well-being. This testing strategy that we use, and I suspect it's very similar to the testing strategy that Mayo uses, emphasizing testing those populations that are most vulnerable, such as hospitalized patients, those populations that are most needed to provide health care and keep the community and healthcare infrastructure running, such as healthcare workers, and then those patients and populations that are most vulnerable and likely to have significant severe infections with COVID-19, such as nursing home patients, members of congregate settings, and then elderly patients, especially those with certain comorbidities. Our testing strategy will continue to be true to that. We do continue to partner with Jen and the county in terms of there are sometimes people who ought to be tested for public health reasons, and we do approach that with them and make sure we're doing the right test on the right person. I'll make just a couple comments about masks. We have an adequate supply of PPE or personal protective equipment here at Gunderson at this time. But if you do go to our website, you would see some opportunities to participate in supplies and masks. We're doing that really out of an abundance of caution and out of an abundance of preparation. One cannot look around what we're seeing on the various coasts and the places that have been harder hit with this and recognize that one cannot prepare enough, and so that's why we're taking those steps. Those would be, I guess, my main comments today, and would turn it over to our other guest.
Fantastic. Thanks, Dr. Kowalski. Appreciate that. And, I would just reiterate what Dr. Kowalski said. Our testing methodologies are very similar, aligned. They're aligned, obviously, with recommendations from many societies, including CDC and others. And so we want to make sure that we continue to follow those recommendations. In part, to add on is the conservation of the supplies that we do have are important. And so we want to make sure that we are actually testing those at most risk. And that way, when and if we need to continue the escalation of testing where we have the supplies we need and we haven't used them in an inappropriate manner. So there is a lot of, absolutely a lot of, that goes into making sure that the right people are getting the right tests, in which I would echo. One of the questions that has come up along the testing line is capacity to test. I can speak to Mayo Clinic, both here locally as well in our enterprise perspective, utilizing Rochester. Testing, the speed of that is not a problem for us. The capacity is about 5,000 tests a day can be run through Rochester, who we use as our testing facility. We are going to be enacting, we had been doing about 2 times a day in terms of our moving those supplies or moving those tests to Rochester. We're going to do that every 2 hours because we're recognizing as things escalate, we want those results as quickly as possible. And again, in part because we want to make sure that we are conserving our supplies, and when we get a negative result back on somebody, that means we no longer need to take precautions on that patient. So it saves, again, supplies for patients we need that will come back positive or other testing that is required. So we certainly appreciate our ability to be able to do that and do that fairly quickly. Testing kits and other supplies, I think we're also for the moment in a good place. Much of that will depend on the spread within our community. If the curve stays relatively flat, we will have certainly several weeks worth of supplies. If that curve does bend, and I'm hopeful that the things that you've heard about social distancing and others will definitely flatten that curve, those supplies will last longer than that. But much of that will depend on our ability, and the number of positive cases that come up could start to eat into that supply very quickly if we get a number of positive cases in our facility. So I'll leave it at that, and if there's other questions, we're certainly open to that. So thank you.
Jason, this question is for you. We'll start with you. Just want to ask first, do you know roughly how many tests that Mayo here in La Crosse has administered?
Repeat the question, if you would.
Yeah. So I was asked how many tests has Mayo here in La Crosse administered, and the answer to that is a little over 400, and that's been over the last 10 days, roughly, give or take. And so we're averaging somewhere between, it depends, it started out about 50 to 60 a day right now. Our drive-through has been our primary testing acquisition site, if you will. Probably 85 to 95% of our tests are coming through drive-through, which is perfect. It's exactly what we want the community to use, is that facility. It really decreases our risk in terms of exposure with one another, and that social distancing concept is held strong. So that's about where we're at. We anticipate, given some of the news and the doubling of some of the things just in the last day, that might increase. And so I would anticipate we'll probably see in the next couple of weeks up to 100 tests a day.
Can you tell us, I guess, from both Gunderson and Mayo perspective, I guess how many tests are being administered now, or maybe differently now as compared to last week or the week before after getting these new cases out?
Since the mic's for me, and I'll go and then have Dr. Kowalski follow up, is that we're following those guidelines. Those guidelines haven't significantly changed in the last couple of weeks, and so those that need testing or are requiring testing are being done. We're following that as closely as we can, but obviously with increase potentially the community. But we've had people essentially prior to that with a lot of travel, and those travel have come back from risk areas. We, of course, wanted to test those as well. So I think some of that travel is starting to wane away, and then that's a good thing. But we'll now probably see more individuals who have had direct contact or with the symptoms that would then require them to be tested.
So I really would echo that response in terms of who we're testing. We continue to test people that are in those vulnerable populations that I shared with earlier. So the who we test hasn't changed based upon community spread, other than how we might partner with community or the county public health department in whatever their needs might be. In terms of our capacity to test, it continues to be strong. So we have the reagents and we have the test kits available to continue to meet the testing needs of La Crosse and our region. And similarly, though I don't have an exact case count, we have tested in the number of hundreds since we've gone up, and similar to the Mayo team, we use our drive up to get much of our testing done in a very safe and efficient manner. I would say, in terms of testing, one of the things I've shared with our clinicians is testing can feel a little bit like counting cases. It's as if when a storm is coming in and you see a case turn positive, it can be a little bit like counting a raindrop. And so while testing can give us more cases, the real critical thing from a community standpoint that we use testing for is to really help protect the most vulnerable who can get ill and to help take care of our healthcare infrastructure. So case counts to me are not quite as important as who are the severity of illness and the degree of illness and the healthcare capacity's ability to respond. And we have a strong capacity and are still in a very strong place in that regard.
Now, although there haven't been a lot of cases in the La Crosse area, I believe the number is about 10 or so, as compared to maybe Milwaukee or like Dane. Do those numbers not really reflect what's going on in both hospitals in terms of kind of the things that you're doing to prepare and kind of the things that you're doing to help prevent any more and kind of help those who have been affected?
Make sure you repeat the question.
Sorry, that was kind of long-winded.
Yeah, I think the question was, does the case counts, does the number of case counts here in La Crosse, even though it's relatively small, does it impact our ability to respond to the sickest folks? Is that?
Yeah, kind of how much more work is going on behind the scenes that people might not realize is going on in the hospitals.
Yeah, so our preparation is really directed at preparing for the sickest of patients and the surge of patients that may come that we've certainly seen in other parts of the country. Counting cases themselves doesn't change a whole lot in terms of our internal preparations because our focus is on being there to take care for the people that need to be hospitalized and need to be ready for that. And we're in a strong position to do that. I would suspect it's the same from the team across at Mayo Clinic as well.
And I know that the priority right now is testing the vulnerable, testing those who are working in hospitals, but if these cases continue to rise, do you ever foresee that changing and trying to test more of the public?
Yeah, so the question really being about changing testing criteria as cases continue to rise. I think who we test needs to be finely calibrated with our capacity to test, and it needs to be finely tuned into what are the goals of testing. If we had unlimited resources and capacities to test here in the United States, I suspect both of our systems would be testing significantly more than we are. But that's not where we're at. We are blessed in La Crosse County in this region to have capacity to test the people who need to be tested. That's not the case everywhere. Even just yesterday, the Centers for Disease Control changed their testing priorities and guidelines and criteria to really come right in line with how we've been doing it all along. So for the foreseeable future, I would say to the public and folks who are watching, looking for a lot more testing in people with mild symptoms or no symptoms whatsoever is probably not where the focus should be, but rather on staying home if you're not feeling well, recognizing that mild symptoms that may be consistent with COVID-19, such as a sore throat, body aches, cough, in and of themselves, one can isolate for at least a week and at least 3 days beyond those symptoms being present, and you've done your part to help keep the Cooley region well and safe. And that would be my message.
For both health systems, I guess, are supplies kind of running low, or do you have enough supplies to last right now to help those populations of people coming in to get tested?
Yeah, sure, I'll take that first and then pass it over. Again, I think supplies, the two main areas of supply concerns are personal protective equipment, or PPE, and testing reagents and supplies. And in terms of personal protective equipment, we have an adequate supply to provide care to our patients and what we anticipate to be an influx of patients. But we continue to, as does every healthcare system in the United States right now, actively work to acquire more to make sure we have what we need to keep our healthcare workers safe. Regarding testing, we have right now adequate supply and capacity to test into the coming weeks as it stands right now. But we'll continue to calibrate those reagents with indications for testing and what the situation is on the ground. I'll turn it over to Jason.
Thank you. No, I absolutely.
Oops.
I would absolutely echo that. And probably the one thing that I don't think we think about resources, the most important resource is the healthcare worker. And so we can have all the supplies, but if we don't have that supply of individuals that obviously use those supplies and take care of these patients, we're going to be in a much different situation in which we want to be. So we're taking, I think part of the question earlier was too about what are we doing to prepare ourselves as an organization. And part of that is making sure we safeguard as much as we possibly can our staff. And part of that, I know that both organizations have really taken a strict policy on the visitor. And I know that's very difficult at times for families and visitor or patients ourselves, but That is to protect them as well as our staff, because without that staff and with increasing illness in our facilities of COVID, you can imagine that would spiral in a very bad way very quickly. So we've reacted in a way that's, I think, in line with much of where the rest of the country has gone. I think even we may have been ahead of that curve a little bit in some of that, but our resource really is important. We can't man the vents. We can't put the IVs in if we don't have the physicians, nurses, and other allied health staff. So we are as well screening our employees for symptoms. We're screening them and asking them as they come in our facilities to get a temperature taken every day to make sure that we certainly don't have someone who may not know yet or start to exhibit early symptoms, just as another safeguard to make sure that we are doing the right things for our employees. One individual that may come into our facilities that we are not aware of, whether that's a patient, a visitor, or an employee, could come in contact with tens of many people, and all of those individuals would potentially be quarantined. We'd have to do that assessment, but in small facilities where we're talking about hundreds and thousands of employees, very quickly that could decimate an ICU or could decimate an area of our organization. So we want to be very careful about the most precious resources, which is our staff.
Now that we have confirmed cases in La Crosse County, how do you see that changing in positive case numbers coming in or looking towards that?
Musical chairs.
So the question is, now that we have confirmed cases in our county, what do we expect next? Is that what the question is? I think we know. The story is the same, really, that we know that individuals who need to be tested will be tested, that we are likely to have additional cases. I think this is hopefully, though, a turning point for our state. We're going to have a little lag time between the number of people who are being tested, this safer at home order going into place, which hopefully is minimizing the movement of individuals around our state, and I'm hopeful that that will help to keep this number of cases low. But remember, the case count, as we've all talked about, is only one indicator of where we're at with this situation. It really is about individuals taking the right steps to prevent the spread of this virus amongst each other. So now that we know we have community spread, we know that if you are out and about, you are likely to come in contact with this virus, whether it's from someone who is symptomatic in the community also doing their grocery shopping, which we hope is not the case. We hope that people are listening to our messaging, but that could still happen. And you also could be touching objects when you're at the grocery store, when you're at the pharmacy. You need to think about when you're going into those locations that it's quite possible you're touching contaminated surfaces and you might come into contact. So do your social distancing even when you're doing your essential travel to the pharmacy, to the grocery store, to the doctor's office, calling first, of course. Making sure that you're not touching your face, that you are not eating before you wash your hands with soap and water. So I think if we do all of those things, we'll help keep our case numbers low, we'll help keep the number of people that might end up with severe disease very low in our community.
Kind of coming back to the supplies question, I guess, do you two anticipate a time where you'll be able to really test anybody who has symptoms, or do you anticipate there still being kind of restrictions on that aspect?
Well, my response would be, for the foreseeable future, our testing strategies will stay focused where they're at. I think there are so many unknowns that to try to predict where we'll be in 2, 4, 6, or 8 weeks or months is just getting ahead of ourselves. There is certainly as testing capacity increases nationwide, there may be a time in the months to come, as we're still dealing with possibly many surges and ongoing issues with COVID-19, that testing may be a much bigger piece of the puzzle. I want to just echo what Jen said to the county, and then I'll turn it over. That, if we use the analogy of COVID-19 as a coming storm, which I often do, and I often consider cases as counting raindrops, one thing that's amazingly different that every individual in this county has the ability to do, that you can't do with a storm, but you can do in this case, is you can change the trajectory by your individual actions and responsibilities, by socially distancing, by staying home, by keeping your family home and together. That's an amazing, both, it's a privilege in some ways, it's it's part of our social network and interconnectedness to do that for each other. And so that's just one more piece of encouragement that isn't, it's not technology, but it's way more important than testing.
Did you want to
No,
speak
I
to
don't
that?
have anything
No?
else to add. It was said very well. So.
Okay.
Well, how many hospital beds do you have in the county, and how many of those are for ICU?
We'll do this back.
In the county.
So I don't have the county counts. I know that what I can tell you without getting into, again, sort of counting beds and ICU and ventilator status, which is really not where I'd like to take it, I will say that we are very well prepared. We have developed surge planning. We are executing on surge planning. We have, we know exactly how many events we have. We know how many cases we have, and we know how, as cases might start to roll in, where we would cohort them and how we would manage them. So we have the plans in place, and we have the capacity at this point to take care of the needs of this community and region.
Again, fantastic answer. I would echo that. I mean, we're at a point where we're doing lots of scenario planning with surge capacity discussions around, particularly obviously with the ICU component and ventilation or using ventilators, et cetera. So numbers really depend on what capacity is needed. And I agree that between our organizations, we have a lot of capacity and a lot of ways to think differently about the way that we provide care. And we're doing that and working very hard at being prepared to do it.
I think it's been exactly a week since we got our first 2 confirmed cases. Now we are at 12. To me, that seems low. Like, I think I would have thought it'd be much higher. Is that what you guys are thinking? Is this a good pace?
Want me to talk about that?
Sure.
This is our physical activity for the day. I don't know that I had a number in mind about what to expect when we talk about a week ago having our first case to this point having 12 cases. What I can say is I am just so grateful that none of these individuals that we're talking about, these 12 individuals, have severe disease. No one has required hospitalization. So we are hoping to keep these numbers low in our community. We know, though, that there are individuals that have symptoms that have not needed to be tested to know what to do. And so, we just need to stay the course and make sure that we continue to follow the guidance we're being given, and that means all of us, whether we're doing essential travel or not, we need to follow that guidance, because only by working all together are we going to beat this.
There's been, some people still call 911 to kind of get some information regarding COVID-19, but obviously that's something people shouldn't do. Can you just reiterate again kind of those resources where people can get a hold of the right people to kind of get that information and kind of more or less ask questions?
Yes. So the question is, where is the right place to go if you have questions about COVID-19? If you have any kind of a general question, one of the first places that you can go would be to our call center, which is 785-6240. And I'm looking at my team to tell me if that's right. 6240 is what I think it is. And so that is the call center number. We also have resources on our website, lacrossecounty.org/COVID-19. In addition, if you have a healthcare question in particular, we know that especially if you have symptoms and you aren't sure what to do, we would say call your primary care provider, and we would ask you to go through that route, always calling first. If your symptoms are severe and you're worried about your symptoms, the normal routes are still in place. You can contact 911 if you are severely ill and cannot appropriately get to the ER. So I think we have to just think about what's happening. If it's a general question, we would not want to call 911. We would want to reserve that for the most severe situations for 911 response. And other questions would be routed appropriately to either the call center or through website resources and materials that are available.
What kind of answers can your experts more or less answer?
We get calls at the call center about all sorts of things. Everything from the new Safer at Home order and is my business exempt to I think I have these symptoms, what do I need to do? To do I need some kind of a travel voucher to be on the roads right now? We get all sorts of questions. So the point is, if you have a question, we'd rather you connect with us. I did not mention previously, but we also have a very good following through Facebook and Instagram, so you can contact us by social media as well. We have great staff that are responding very quickly to the questions that you have, because we want everyone to have the information needed to know what to do and to get responses so that they can take the right actions.
Some questions that I'm seeing here, are any empty buildings, for example, the dorms at UWL, being looked at as potential sites for temporary hospitals?
So there is some I don't know about temporary hospitals. I'll let the healthcare folks answer that question, but we have been looking at sites in the community, for example, for special populations. So those that might be at risk of either being exposed to or spreading the disease. So we are looking at those kinds of sites. I'll let the hospital folks talk about if they are looking at any external hospital sites or locations.
So we have a team that's working on surge planning for things if it should get to the point where we need additional space outside of the hospital. That's done in coordination, frankly, with the county and the city, with a planning group. So there are people working on that. I don't have any other details to share about that, though.
Hey, John, we got a question on Facebook. What is the status of the first cases, and are they considered recovered?
Yeah, good question. So the question was, what are the status of the first cases that we had, and are they considered recovered? I know that one of them is considered recovered, and we're going to get better at identifying what you've asked us to identify, which is confirmed, probable, how many tests. We're still working on having a solid number for those, but yes, one of them has recovered, and again, the rest of them continue to recover at home in isolation with their symptoms and are all doing okay and are not experiencing severe illness.
Obviously, this has been kind of unprecedented and kind of worrisome for a lot of people. I guess for those people who are maybe on edge or stressed in this situation, what should they do, or what can they do? Maybe.
Yeah. So the question is how to handle stress with this situation. So first, I just want to recognize that there has been a lot of change, and change in and of itself can be very stressful for individuals. So we totally understand that. I think while there are things that we cannot do, there are many things we can do. We still can get outside in our backyards when it's not raining, and we can get some sunshine when the sun is shining out there, and we can call our friends and relatives on the phone, or we can utilize technology to connect with them. There are many things we still need to have emotional contact with others, with loved ones, with pets, with, this is a time that you might bring out board games and play board games with your family. So get creative. Now is the time for that. Those things will help with stress. If you have never tried meditation or yoga, perhaps now's the time to do that. You have some time to be at home and try something new and get creative with your family. So I would encourage all of those things to help with stress.
I did have one more. I know yesterday that you had brought up the National Guard possibly coming to help and everything like that. Can you maybe kind of reiterate that and kind of what they had planned to do or anything like that?
So what I spoke about yesterday with the National Guard was that they have they are working on getting a buyback program set up for personal protective equipment. I don't have any additional updates on that, with the exception of they had said yesterday that today they would be working to get that up and running for that buyback program. And the goal of that is to bring out PPE or personal protective equipment from where it might exist in the community, have the government buy it back, and then help to make sure it gets to where it needs to go.
Is there anything else that either one of you three would like to add about kind of anything about the information you kind of heard today, or anything in general that you'd just like to let the public know?
I would just say to all of you who are practicing social distancing, thank you. You're making a difference. I think this is a time that as a community we can move forward together, and by doing that you can actually make a difference in the lives of your friends, your family members, and your neighbors. And you've got some great health care here in La Crosse County to be there when you need it.
Yeah, just say one thing. The only thing I would add to that is this community is special. If you just look around how many individuals help each other out every day, even before this incident was around, I think that's going to be our greatest asset as this continues to go forward, that people understand what it means to be in a community and how that community works together. And I just echo the comments about social distancing and other things, but we certainly have a lot of confidence that this community will do the right things, and that will help definitely flatten this curve, and its incidence and effect will remain low, hopefully.
I think we're all good.
You've been watching and listening live to a daily briefing from the La Crosse County Health Department, joined today by representatives from Mayo and Gunderson. And I do want to give you a few numbers here before we say goodbye. We did get an updated count on the number of COVID-19 cases in Wisconsin, confirmed numbers now at 585 cases, negative cases over 10,000. And that means the rate of infection of people being tested is about 5%. There are 6 deaths now in the state, none of those in La Crosse County. But we did learn today that the count in La Crosse County is increasing. 12 cases now confirmed in La Crosse County. The 2 newest cases are females in their 20s and 30s. We heard here from the health department director that their symptoms are mild to moderate. Both of them are isolating at home. And again, I want to stress, no deaths in La Crosse County. In fact, no hospitalizations. That's what we heard from the health department director. And she also let us know this afternoon that 1 person out of that count of 12 has recovered. So that is good news there. Representatives from Mayo and Gunderson letting the public know that they have adequate supplies on hand to protect healthcare workers. They have adequate supplies on hand to test the public for the foreseeable future, for the coming weeks. They were applauding everyone for their efforts of social distancing and staying at home, and they're telling the community that it's working, and they're urging people to continue to follow that directive from Governor Tony Evers, the Safer at Home order becoming effective today. We have lots of information about that on our website, frequently asked questions, answers to your questions. You can find those at wxow.com/coronavirus. For now, we're going to return you to your regular programming. Our coverage picks up right here on Live at 5. Thanks for watching.